Hi, my name is Dr. David Perrine, and today I want to talk to you about a condition called plantar fasciitis. Might be familiar to you. It is a problem where we get a tearing of the ligament, special ligament that attaches from your heel bone to the front of your foot, and that helps to keep that arch supported. What will happen, unfortunately, for a lot of people is they get a tearing of that ligament due to maybe an overuse injury in sports, poor biomechanics, poor alignment in the hips, which we will talk about in a moment, or their footwear is just not supportive. So what I do is I look at sort of a four-prong approach to treating plantar fasciitis. Number one, we're going to look at the alignment of the hips. So this is the foundation here for everything up above. And you might have heard what's called the Sacroiliac Joint. So this is the sacrum, your tailbone. Your hip bones are the ilium. So this joint moves, and if you look, that's going to pull on your thigh bone here. So if that joint is out of alignment, it's going to pull that thigh bone up, and now we're going to stand crooked, and that's going to put a lot of pressure on the feet. Another thing that we do here at the office is we use a special foot scanner, and what we will do is we will look at pressure on the feet. So this one over here, we can see we've got a nice green area, so we can tell we've got a nice arch, and as we progress here, it is what we call pronation, where that foot starts to roll in and we lose support on that arch. Now that's going to create a lot of tension and a lot of pain in that heel. So that's what we're going to look at, doing maybe a custom orthotic, and we use a mobile orthotic that's going to help support that arch and take the stress off of that foot. The third thing that we do is acupuncture. Been amazingly effective for not only pain, but also stimulating blood flow to those areas, because we've got a damaged ligament. Unfortunately, ligaments do not have a good blood supply, and that's why they can take a long time to heal. So the acupuncture can help not only with modifying the pain, but also stimulating that healing process. The fourth thing that we're going to do is give you some different exercises to do. Many people with plantar fasciitis suffer from having tight calves, tight legs, and some of that is just due to what do we do all day? We sit. So let me show you a couple different stretches that we're going to do. The first one we're going to do, so if I'm going to stretch that right heel, I'm going to put that leg back straight, I'm going to lock my knee out, and then I'm going to lean into the wall while keeping that leg straight. We're going to hold that for maybe a good 20 to 30 seconds, okay? Then we're going to do the same thing, but we're going to bend that knee, and we're going to lean in. That hits a little bit deeper, so there are two groups of muscles that attach to that Achilles tendon. One is the gastrocnemius, and the first stretch is going to stretch that out. The second one is called the soleus, and the second stretch is going to stretch that muscle out. So we want to make sure that we stretch both of those muscles. There was a really interesting study that I just read about the utilization of acupuncture for plantar fasciitis. To enter the study, these patients had to have had pain for a year, so that's a really chronic issue. They have had to have had orthotics, they've done the supports, and they've gone to physical therapy. So all three of those things and no improvement. Well, they put these patients in an acupuncture trial, and they showed significant improvements. So acupuncture has been phenomenal for plantar fasciitis. If you go to my blog, acupuncturepointers.com, I talk about a case of one of the baseball players that I worked with who had an injury back in the fall, and we saw him in the spring and he was still having issues, and we utilized acupuncture and got him back on the field. So if you're having issues with plantar fasciitis, hitting that four-step approach of aligning the hips, making sure that we've got proper support, utilizing the acupuncture, and getting the exercises, and we can help you get back on your feet, literally pain-free. Have a great day, and hope this helped. If you found it something of interest, please share.